Good evening, everyone. Hopefully everyone can hear me. My name is Sharifa Sims Williams, and I am Director of Communications for the Normandy Schools Collaborative. And I want to welcome each of you to our meeting tonight. Can everyone hear me? Oh, hold on. Okay, hear me okay? Okay, great. As you all know, Normandy, along with a lot of other schools, getting messages that people can't hear. Okay. As you all know, Normandy, as well as other school districts in the past, since we come back from the winter break, have been grappling with this new Omicron variant, as well as the Delta variant. The Delta variant is still out there. And we've had an increased numbers of COVID cases, not only with students, but with staff. We've been hit pretty hard with staff diagnoses. And so as a result, we've had to change and pivot a few times in the last few weeks, going to remote or virtual instruction in order to accommodate the staff absences. And so we wanted to talk to parents and family members and staff about one, there's been changes. As you all know, the CDC changed the quarantine and isolation time periods. And then also we've had to, there's just been a lot of changes. So we wanted to kind of update you on some of the district's mitigation plans and what we've done in order to help accommodate some of those changes that have been passed on from the federal level. And then, so what we're going to do, we're going to have a presentation from our CFO, Dr. Phil Pusateri. He's going to provide an update on the district's mitigation plans. And then once Dr. Pusateri finishes his project, or finishes his presentation, we also have a special guest speaker from the medical community to answer some questions that some of our parents may have regarding what has gone into the second year of really dealing with this virus and the aftermath of it. And so I'll introduce Dr. Monique Williams once Dr. Pusateri does his presentation. Dr. Williams will she'll give a brief presentation, just kind of update you on some of the COVID facts and some of the things that we all need to know as community and family. And then once she finishes, we'll have questions. And if you have questions, we'll ask that you put them in the chat, or you can do the Q&A. We'll try to get to as many questions as possible. This meeting is being recorded, so we will also post it on our website and our social media channels. So if you do have questions, or if you know people who wanted to attend and weren't able to, we will post this meeting so that they can get this information as well. So at this point, I'll turn it over to Dr. Pusateri. Dr. Pusateri, the floor is yours.
Okay, good evening, everyone. Can you hear me okay? Sharifa, can you hear me? Let's see, I can't see your faces. You said yes, you can hear me? Okay. And can you see my screen? Great. Okay, good evening, everyone. Thanks for tuning in. What interesting times we live in. What an opportunity to learn, to collaborate, to listen to each other, to do the best we can to problem solve with unseen kind of new challenges. So if we can be grateful for something, that's one thing I think we can be grateful for. Tonight I'm going to walk you through our district's safe return to school plan. What I'm going to talk about includes both the key points and everything that the board had approved way back at their August meeting when this plan was first developed, as well as some updates that have happened as recently as last night. I'll talk about contact tracing, what it is. We'll go over some key definitions. We'll talk about what happens if you are exposed or you've been identified as been contact traced and been around somebody who's been positive. We'll talk about what happens if you test positive. What does that look like from a Normandy Schools Collaborative viewpoint? We'll go back over our mitigation strategies. I'll share the ways that we're collecting feedback on the plan. And then the final slide, I'll be talking about how COVID is affecting school operations. So one guiding principle for us is that our plan has always been aligned with science. We believe that we think it's important that our plan aligns with CDC guidelines and or State Department of Health guidelines and or County Department of Health guidelines. We've been working closely with the special consultant who is the head of pediatric infectious diseases at WashU. He met with families back in July of 20 when we were thinking about what school would look like. And we were at Lucas Crossing and there were some families who came in, and you may have been there when we first had that meeting with families about COVID. Dr. Newland reviews and gives feedback on each iteration of our plan before we present it to the board. I'll let you know that the cabinet meets weekly, and a part of our standing aspect of our meeting is to review COVID data. Also, this plan is posted online at the web page on the screen. Some real important guiding messages of our plan is we want to provide as much in-person quality instruction as we can, as long as we're following public health agency guidelines and students are staying safe. And also universal masking. The only exception is when eating and drinking or when outside in an uncongested area. But universal masking, our community supports and our board is supportive. We understand that universal masking in schools actually has been shown by WashU to lead to stable cases among regional schools that have universal masking. Dr. Newland shared that with us today. In some cases, there's even a decrease in student cases of COVID in schools where there's universal masking. Contact tracing. I'm sure you've heard that term, but we want to break it down. Contact tracing is first I've identified that someone has tested positive. That person is then isolated or removed from others. The facility staff sanitizes and disinfects the exposed area. Staff and families of the children who were exposed are notified. Nurses would administer rapid tests and then share results with HR. And if it's a child who's tested positive, then there's a communication of the positive, that the child has tested positive as well. We maintain a data dashboard of the positive cases as well. Definitions. When we talk about COVID, the definitions can change. They change based on the latest CDC guidance, which is following the science as this pandemic develops. A new term that came up was isolation. And isolation is what happens if somebody tests positive. Someone who tests positive needs to go into isolation to separate themselves from others to prevent the possibility of spread. If someone's positive and they were around somebody for 15 minutes or more within a 24-hour period, within 6 feet, masked or unmasked, then everybody who they were with for 15 minutes in less than 6 feet is considered exposed or in contact trace. That means that they're at risk of possibly having caught COVID. So we will talk more about that. If someone is exposed, what the next steps are for them. That means they've been around somebody who tested positive. Quarantine. Quarantine refers to people who are exposed, but they've not tested positive, but they are still isolating themselves to prevent the possibility of spread. Another definition is fully vaccinated or up to date. This definition changed with the CDC recently. Now, fully vaccinated means you have either received your booster or you're within 6 months of receiving your second Pfizer or Moderna dose, or within 2 months of receiving the Johnson & Johnson vaccine. I received my Johnson & Johnson vaccine in March, so I definitely would not be fully vaccinated unless I had my booster, which I do. I'll add a side note here. Another thing that the board approved last night for staff was a $100 stipend to all staff who demonstrate to HR, who volunteer to turn into HR and leadership their proof of booster shot. So there's a payout that comes with that, and staff would stay tuned to hear from HR about the process for that. We know it's a lot less than the $750 that staff received earlier in the year, but we still wanted to give some incentive to show that you've been boosted, because that helps HR to know who's fully vaccinated. Because there's different rules with regard to quarantine if you're fully vaccinated or not. Test to stay. This is something else that was updated by the CDC just less than a month ago, and allows exposed staff who are not fully vaccinated to still continue working on site, as long as they don't have symptoms, and as long as they remain fully masked, and as long as they test negative. Negative means you don't have COVID. Positive means you do. I'll keep rolling through instead of checking the questions now. Exposed students or staff, what next? So you've been identified in the contact tracing process that you were around someone who was positive. If you're a staff member, you won't be told that because by HR, because medical data is private, but you will learn that you have been around somebody who was positive. If you're a K through 12 student, this is what happens if you're exposed. You stay in school if you have no symptoms. You stay masked. You are supposed to miss field trips and before and after school programs, though, if you're under modified quarantine. That's the same procedure that we've had ever since August, since the summer. Students stay unless they have symptoms. Now, parents on the call, it's real important that you talk with your children about symptoms and keep children at home if they're not feeling well. One of the biggest causes, besides not wearing masks, masking is one of the most important, and vaccination is also important, is making sure you stay home when sick. What's next for a preschool student who's been exposed? Well, we made a change in December where preschool students actually need to quarantine for 10 days. And this came through the County Department of Health. So because preschool students aren't as able to kind of manage their ability to sneeze and spread, they are just going to quarantine. Fully vaccinated staff. You don't need to quarantine. If you don't have symptoms, you don't need to quarantine. You may seek out a test if you'd like, but you do not need to quarantine if you've been exposed. If you're not fully vaccinated as a staff, you may test to stay. You'll work more closely with the Human Resources Department on exactly what this looks like, but in a sense, you would be going to a nurse, and if you're negative, you will stay. And then they would likely do another test around 5 days since your contact with the person who was positive, and test you again. And if you're negative, you continue to stay at work. Remember though, you must remain fully masked and you must be asymptomatic. That means no symptoms. You have to feel good. Don't come to work if you're sick. Also, if you're not fully vaccinated and you choose not to test to stay, you will need to quarantine, but you will need to use your own sick time for that full 5-day quarantine. And it's just a 5-day quarantine now instead of a 10-day quarantine. And that's based on CDC guidelines. So that means we should be having staff come back sooner than the old 10-day quarantine that happened if you were exposed. If you are positive, what's next? Well, you need to seek medical attention, go into isolation away from others, and then return after the 5th day beyond the start of symptoms or beyond the date of a positive test. As long as the symptoms are improved and you haven't had a fever for 24 hours without taking any medicine. So you can't take a bunch of Tylenol and say, I'm fever-free. It actually has to be without any meds that reduce fever for 24 hours and your symptoms are improved. When you come back after that 5th day, you need to be masked except when eating and drinking. Okay? So for staff on the call, that's a really big change. It used to be you had to be out 10 days. Last night, the board approved that change to 5 days as long as you don't have symptoms and you haven't had a fever for 24 hours without fever meds. Okay? So HR is mobilizing to communicate this to all the staff who are out right now. And I understand there may be 50-something staff eligible to come back tomorrow as long as they're feeling good. So that's good news. Preschool students will isolate for 10 days. What are the best things we can do to mitigate against COVID? Well, we can keep on wearing our masks correctly. Cloth masks are not as good as surgical masks, and surgical masks are not quite as good as these KN95 masks. And if you're a staff member, see your principal or the facilities team member to request one of these. But correct masking and keeping your mask on is very important. Stay home when sick, become fully vaccinated. The chances of death are 20% less for fully vaccinated folks. It's that the statistics are astounding with regard to the protection that can occur if you're fully vaccinated. And I know Dr. Williams will be talking about that in greater detail with greater knowledge. We try to use strategic distancing when possible, and we do our best to maintain safe and clean facilities. The plan is listed on our webpage. If you have any feedback on the plan as a community, I do ask that you email that to me, or you can call. And if I'm not available at the time, leave a voicemail on the plan, or feedback in general, because we continue to see community and staff input on this plan. We did run a survey about a month ago and shared that amongst the leadership, and we appreciate those who participated in that. Now let's talk how COVID is affecting school operations. I think just within the last hour, the cabinet leadership team met and reviewed data from the various schools. And we made a decision that Lucas Crossing will be going to remote learning tomorrow. But there's lots of ways that COVID is affecting us as a school and as a school system. Certainly transportation delays are occurring. We're already about 30% short of bus drivers. And when bus drivers become out, they oftentimes need to run a double route. Parents and students, please be kind and understanding to your bus driver and the transportation team. Just so you know, we have raised our starting wage rate for bus drivers to $20 an hour. We have a signing bonus. We offer free training for someone to earn their commercial driver's license, CDL, to become a driver, and they actually get paid while we train them. So if you know anybody looking, please encourage them to contact our Human Resources Department. We're also one of the only districts to offer full health insurance for all of our drivers for a full year and guarantee 30 hours of work per week. So you put all those things together, and it's among other driving bus driver packages, this, I believe, is the best one. How else might it affect our remote learning? Might it affect our districts? Well, we're pivoting to remote learning, and that's largely due to staff shortages because staff are not feeling well. It may be COVID related, it may not be. It may be that the staff members are caring for a loved one. And one of the issues, though, is that we don't have unlimited remote learning days like we did last year. Last year, we had days and days and days, and in some cases all year, where we were remote. This year, though, the state is only allowing, well, for one, the governor has ended the state of emergency. And just speaking for myself, of all the times to end the state of emergency when the cases are skyrocketing, I don't understand that decision. But the other space is that there's only 36 hours or 5 days of remote learning that are allowed all year. In some cases, in September and earlier this year, we've just done a grade level at a time. At Lucas Crossing, there were a few grade levels that had days out in September. Barack Obama had a grade level out for a few days in December, and Jefferson had a grade level out as well for just a day. This semester, though, we tend to be just doing the whole school instead. Once we run out of those hours, we'll be running into school cancellations. Lucas Crossing tomorrow will have used their final AMI day. They won't have any more remote learning days, and after that, it'll be a school cancellation if we don't have enough staff to cover the day. Now, state statute requires that we provide 1,044 hours of instruction per year. So basically, it's going to be likely that we'll have to make up days after the school calendar says the year's over. So the school calendar says the year's over May 27th, the Friday before Memorial Day. But the more we have teacher shortages and teachers unable to staff a building like we do at Lucas Crossing tomorrow, then the greater the chance we'll need to have some additional days of school to make up for this in June. Another approach that we're considering is an in-person learning with a modified curriculum. So in short, we're looking at an online learning platform or model that's going to engage students, but you may not need to have a certified teacher in the room. We might be able to have a building aide or a paraprofessional or a coach in the room, and the students are still engaged with grade level content on a laptop or a Chromebook, but it's not necessarily with the teacher there as much as just another adult to make sure that the students are engaged in learning. So these are some of the options that we're looking at as we go against this 36-hour rule and the challenges we're having with absent staff. At this point, I'll look into the questions in the chat and see what questions there are. Sharifa, unless you wanted to guide that, but I'll.
You can go ahead, Phil. That's fine.
Okay. Okay, one question says, I would like, this is our first year in the district. I don't have a Zoom code for face-to-face instruction. I'm supposed to log into iReady. I would say to that parent to continue to have dialogue with the assistant principal and the principal, and to try to problem solve and get some clarity. It's part of our job is to make sure that everybody, that we do our best to make sure that families can understand what their learning options are for their child. We also have some support here at the district if needed, but we really recommend you start with your school principal, and your school principal or the assistant principal, or if there's a counselor, that they would know at the building level the best way to start. After that, we have a curriculum and instruction team that can assist with those. Okay, this I believe is a staff member who says, if I tested positive and have quarantined for the recommended days, but continue to test positive, can I return to school if I'm fever-free? That's a good question. And I think I know the answer, but I am going to hold off on that. And we will, Sharifa, I think it's good if we put together an FAQ with these questions that I don't have all the answers to right now to share with staff. Next question. Why are some staff required to be in school for virtual teaching and others allowed to teach from home? I understand all staff should come to school for virtual teaching. There may be some exceptions if someone is ill and they are still teaching from home. And I think that those exceptions are made on a case-by-case basis. But in general, if a school goes remote, like tomorrow Lucas is going remote, then we are asking teachers to come in, teachers who are well to come into work. How are they knowing that children or staff have COVID? I don't understand that one. And somebody said, actually, this is crazy. You're able to come in, work with COVID. And it's not that you're able to come and work with COVID. This is the new CDC guidelines, is that it's been 5 days. And the 5 days that I understand that you're most transmissible are the 2 days right before your symptoms start and the 3 days after your symptoms start. So if you get the 5 days from the first day you start symptoms or the first day you test positive, and you stay fully masked the whole time, and you have no symptoms, then it's very, very unlikely that you will spread COVID. So we're just following the CDC guidelines on that regard. Next question, what if I received a letter that my child was in contact with someone who tested positive, but we let him come back the next day? That is correct. That's what we said. That's been in our plan the whole time. If somebody was in contact with someone who tested positive, then the child who was in contact may still come back. They're going to be in modified quarantine. They have to wear a mask, and they should miss field trips and after school and before school events. If you're saying that the person who tested positive was back at school the next day, that wouldn't be the case. We wouldn't allow that. And I don't think we're allowed to tell you who is tested positive in your class. So just be careful if you think you know who's positive, because that's not something that we are allowed to share. How much longer do you think Lucas Crossing will be out of school, since tomorrow is the last remote day allowed? What's in place to ensure instruction is still going on at home? Packet pickups or something? It's a great question for our team, and I'd like to add that to the FAQ. Lucas Crossing is looking at closure. We're looking, if we don't see returns to staff, then we probably won't have school at Lucas on Friday. Our hope is that with the rule change last night, with the board saying that healthy people who are feeling fine, either quarantine or positive, who after their 5 days will be back, our hope is that we won't have to keep on shutting down Lucas Crossing. But that's a good question. If we do shut down, what are we going to recommend for students? And that's a good question for us to note for our team to answer. How long are you thinking they may have to go to school this year? You know, I hope that we don't have to have any school days after Memorial Day, but it's possible that we will. I'll tell you, it doesn't have to be in June. If the board approves a revised calendar where maybe right now the children have an early release day on Fridays. Well, what if we just stopped having early release days on Fridays, and we used some of those early release days to make up some of these missed days? That's another possibility that we were discussing today. We're not locked into that, but that's a possibility. If days need to be made up for AMI days, will teachers receive additional compensation due to basically teaching that day twice? Meaning, the day already was taught virtually, but then have to make it up in person? That's a good question. And the AMI days don't need to be made up. So AMI days count as real school up to 36 hours. Once you get beyond 36 hours, then they don't count. And then you have to make it up. So we are not yet in the territory where we have to make up days. And you don't have to make up AMI days. AMI days really do count. Are there any specific modifications to any of these guidelines for children with SSD? Yes, there are specific modifications to these guidelines for children in special school district. There are reasonable modifications that may be made that is overseen by our SSD team, as well as our Director of Special Programs, Dr. Cheryl Harris. And certainly we want to meet the needs of all of our exceptional learners. And in some cases, there may be modifications for children in SSD.
Phil, take one more question, then we're going to go ahead and switch it over to Dr. Williams, please.
Okay. Some questions about lunch that we'll try to clarify as a team on an FAQ. And then the next question was, just to clarify, after the AMI days are used up, school would just be canceled with no learning going on. At this time, that is a possibility that we'll be doing that. Okay, that was the final question that we have now for time. Thanks, everyone. We'll do the best we can to post this somewhere with the responses that we can, Sharifa, and thank you. I'll stop sharing and appreciate your time.
Okay, thank you, Dr. Pusateri. Appreciate it. If you have other questions that we weren't able to answer or are not captured, you can email those to info @normandysc.org. That's our like a community inbox where I collect those emails. A lot of times if you've emailed, I'm the one that's answering those. And we'll try to get that FAQ put together, and we'll just look out for your email or on social media. Once we post this video, we'll try to get that FAQ together sooner versus later, hopefully by the end of the week, because I know there's a lot of confusion and there's a lot of questions, and we want to try to get you the most accurate information so that we can all try to get through this pandemic safely. Okay, we're going to switch to the second half of our meeting. Like I said, we want to get out here at 6:30. I invited Dr. Monique Williams. I serve on a group that we talk about a lot of COVID mitigation plans for St. Louis County. And Dr. Williams has spoken with this group. She participates with this group, and I thought she would be a good person to share some information and also to answer some of your questions. Dr. Monique Williams, I'll give you a brief introduction. She's a graduate of Washington University with a bachelor's in biology and French. She has her MD and MS in clinical investigation. She completed her residency and fellowship at Barnes-Jewish and joined the faculty at Washington University School of Medicine. Following 2 years in Texas, she returned to St. Louis and has worked in long-term care, hospice, and primary care. Christian Horizons is a senior living provider in Missouri, Illinois, Iowa, and Indiana. And Dr. Williams is the medical director, and she is serving in St. Louis City and County to provide senior home-based care. She's a member of the National Medical Association and Mound City Medical Forum, and she has served as president of the Mound City Medical Forum since 2016. She serves on the St. Louis County Department of Public Health North County Outreach Group to increase COVID-19 vaccine confidence. And before we go to Dr. Williams, I have a poll, a very quick poll, say yes or no. I'm going to launch it right quick. It's a confidential poll. You're not asked for your name or anything, but just to kind of get an idea of our family's level of confidence with vaccinations. We know that vaccinations have been touted as one of the ways to help prevent COVID, but we also realize that there are some concerns about it. So I'm gonna launch this right quick. If you would just answer it, and we'll go right into Dr. Williams. Dr. Williams, if you're ready, we can go on with your presentation.
Excellent. Thank you so much for having me this evening. And let me just pull up my slide deck. One moment. Okay, there we go. Good evening, everyone. As Ms. Sims-Williams had mentioned, I also serve on the North County Outreach Group trying to address vaccine hesitancy and increase people's awareness of the importance of COVID-19 vaccines. And just to give you some background, so multiple generations in my family have done research and also worked in microbiology. So talking about vaccines and viral illnesses and bacterial illnesses is something that happened in our household since I was a pretty little kid. And so just to reiterate, I am the medical director at New Horizons PACE, which provides alternatives to long-term care for older adults. My community partners include Mound City Medical Forum, which is our Missouri National Medical Association, the St. Louis County Department of Public Health, and then Quantum Laboratory, which is a local resource for getting COVID testing. So one thing I just wanted to point out about Mound City and the NMA is with the flu pandemic a century ago, the National Medical Association and Mound City locally in Missouri was very integral in the care of people who had the flu. And if you happen to look at the resources that they have for the Journal of the National Medical Association, you can actually find their recommendations for how to address the flu pandemic. They recommended the use of masks. They found that particularly when there was a surge in flu cases in communities, consistent use of masks reduced case counts very effectively. They also showed that adequate ventilation, avoiding overcrowded situations was relevant as well, also good hand hygiene. And the Army was actually looking into a vaccine for influenza at the time, and the recommendation from the NMA was get the vaccine when it's available. So a lot of the knowledge that we have now, we've actually had for a century. So Quantum Lab is a locally owned lab that's over in Bridgeton, and they can get results back in 24 hours. And in terms of the impact of the Department of Public Health and the outreach group, vaccination rates and zip codes of concern have increased substantially. One of the things that's nice is the health department offers transportation with the company VIA to facilitate getting to and fro from your vaccine appointments. And they also have the remuneration with grocery and gas gift cards with completion of a vaccine series. And I just wanted to review some of our numbers now. So I'm sorry, this is actually as of now. So more than 521 million vaccines have been administered in the US. And 74% of the US population has received at least one vaccine dose. So that's everyone from 0 to 110. 63% of the population is fully vaccinated, and 23% of the population has received an additional dose. In Missouri, we're currently at 53% fully vaccinated and 61% fully vaccinated, specifically in St. Louis County, 55% fully vaccinated in St. Louis City. So we're trending upward gradually. So in terms of people who've received at least one dose of the vaccination, we're at 63%, and almost 3/4 of people in the county have received at least one dose, and 68% in the city. So there are some people who are still lagging a little bit behind on getting their second dose, and then their booster at the 5-month window, but we are making some progress. And as you guys know, the emergency use authorization for ages 5 to 11 was recently received back in November. And in the first week the vaccine was available, 1 million kids received the vaccine. And then for week 2, they had 700,000 kids scheduled. And there are 28 million kids in the age group. And if they continue at a brisk rate of vaccination, we could have kids fully vaccinated by the end of February. And one question people have is, what is an emergency use authorization? So one of the things that's really fortunate in the US is that we have a very cautious and proactive Food and Drug Administration. So medications and vaccines and therapies are not approved until there's been sufficient evidence to demonstrate that they're safe and effective. So the process to review a medication for emergency use is as cautious and thorough as it is for the full FDA approval. The concern is, though, in the middle of a pandemic, you don't want to spend years and years and years with the slow review. You want people to focus on that one therapy, go through the process, and get it available to the public in a more expedited fashion. So that's why it's an emergency use authorization. So for kids, they get a pediatric dose of the vaccines. So for the Pfizer vaccine, they get 2 10 microgram doses that are given 3 weeks apart. For individuals 12 and older kids and adults, we get 2 30 microgram doses 3 weeks apart. So the dose for younger kids is appropriately a smaller dose, but it's the dose that in the clinical trials was very effective. And one thing that the clinical trials showed is that the effectiveness and the tolerability of the vaccines for younger children and for older children were comparable to what we saw for adults. So we know the vaccines work in kids, and we know that they are both effective and safe and well tolerated. And the goal of vaccines in general is not 100% prevention of disease, but the goal of vaccines is to prevent severe illness, hospitalization, and death. And even with Delta and even with Omicron, the vaccines remain very, very effective towards this goal. So one question is, how do the Pfizer and Moderna vaccines work? So the way that they work is, you've seen that graphic of the COVID virus that's on every news station. And so the little red outpouchings are spike proteins. What they do is they bind to a receptor that's on our cells, and they go into the cell, and then they cause themselves to multiply. So what the vaccine does, you make antibodies to the spike protein, so you block it. So it's essentially like the spike protein functions as landing gear, but you block the landing gear, and then the virus can't get into your cells and make you sick. So that's the rationale. And one thing that's relevant is the spike protein is unique to the virus that causes COVID, which is called SARS-CoV-2. So the spike protein doesn't look like anything else that you'd see in nature, definitely nothing else you'd see in people. It's a unique protein for this virus. So our body recognizes it and blocks it, and then it can't get into your system and cause illness. So the mRNA vaccines, Pfizer and Moderna, have an mRNA mechanism, and then the Johnson & Johnson vaccine uses what's called an adenovirus. That's what causes kind of a typical cold, but the vaccine can't make you sick because the virus that is used as a vector to carry the information for the spike protein is actually inactivated. So it just gets your body to make the immune response it needs to make to remember how to react to prevent COVID infection, but it can't make you sick. So the virus is harmless, and it's not COVID-19, it's what's called an attenuated adenovirus, or an adenovirus that's knocked out, so it can't do anything in your body. And so pretty much what the vaccine does is it tells your body, okay, this is the spike protein, you need to make antibodies to it, it's something that we need to fight. Your body's immune system recognizes the spike protein from the virus as foreign, makes the antibodies. So J&J is a single dose, and the first part of the course for mRNA vaccines is the 2-dose series. So what's really important to understand is the vaccines are effective even against Delta and Omicron. So from the data that we had from Delta, because we have to get enough information about the illness to be able to learn how the new variant's behaving, but from what we know from Delta, people who had 2 doses of Pfizer or 2 doses of Moderna or a dose of Johnson & Johnson have a 10 times lower risk of hospitalization and 10 times lower risk of death. What we're learning too with Omicron is, even though it causes more breakthrough cases because it's so contagious and is transmitted so much, it still substantially reduces risk of hospitalization and death. When you see people with severe COVID, those are unvaccinated people. So kids and adults that are vaccinated have a much lower likelihood of severe disease. So, and one thing we know as we've gotten to more contagious variants like Delta and Omicron is the vaccines are excellent. They're very effective at preventing hospitalization and death, but the risk doesn't drop to 0. And that's why indoor masking is recommended. So one question is, are the booster shots the same formulation as the original vaccines? And they are. They're the same formulation, but the Moderna booster is a half dose as compared to the initial dose for the vaccines, because they found that that half dose for the booster gives you an impressively good immune response. So they don't have to do the full dose for the booster, but you're getting the same shots that you had with the original vaccines, the same formulation. It's just that the Moderna is a half dose. And again, the vaccines work really, really well to prevent severe illness, hospitalization, and death, even against Delta, and we're finding even against Omicron in terms of preventing the deaths related to COVID. And so the current recommendation from the Center for Disease Control is that individuals who should get their boosters at 5 months if they originally had Pfizer or Moderna. And between Pfizer and Moderna, you can choose which one you want for adults aged 18 and older. For kids 12 to 17, the current recommendation is at 5 months to get the Pfizer booster, because Pfizer is the vaccine that has the emergency use authorization for that age group. So again, booster at 5 months. Pfizer for kids 12 to 17, adults 18 and older, they can choose between Pfizer and Moderna. And it's not surprising that a booster dose is needed, because you get an excellent immune response from vaccines, but it does decrease over time. So the booster helps to raise that immune response up to a high level again, to protect you from severe illness and from death related to COVID. So there also, you might hear about people who get a third dose or an additional primary dose. And this is the thing that first came out on the news from the CDC. People with specific types of immune function disorders, certain transplant patients, people with, like they're born with an immune deficiency, these types of individuals would be getting an additional primary dose. And with those people, they're also going to get a subsequent fourth dose. So, oops, here we go. So I wanted to review this concept of layering, or the Swiss cheese approach. So if you think about it, we know the vaccines are, even against Delta and Omicron, the vaccines are quite good, but they're not 100% effective. No vaccine is. So if you imagine a piece of Swiss cheese with one hole in it, it's not 100%. There's a little bit of a hole. So that's why layering your interventions is crucial. This is why also wearing a mask is important. And as Mr. Pusateri had said, thinking about, the surgical mask is better than the cloth mask, the N95 or the KN95, particularly the KN95s that they have for kids, are better than a surgical mask. So there are the levels of effectiveness, but wearing a mask is particularly indoors, is crucial as well. Keeping with the hygiene and, the good thorough environmental cleaning that we do in schools and clinical settings, physical distancing, and then also, outside of the school setting, when there are large gatherings and places where people will be together and you can't be certain of people's vaccination status, or it's just a crowded environment, trying to avoid gathering can be relevant as well. So you can think of layering all these interventions. So the vaccination is a crucial component, the masks, the hand hygiene, physical distancing, all of these come together to help to protect from transmission of COVID. And so with the Johnson & Johnson vaccine, and our knowledge of the Johnson vaccine has evolved over time. So as you guys know, it's one that's, the mRNA vaccines are advised over the Johnson & Johnson vaccine in general. But if someone has received the Johnson & Johnson vaccine, the initial shot series is just one shot. And then 2 months after, at least 2 months after receiving that primary vaccine single dose, once you get a booster, and in most cases, it would be the mRNA booster, Pfizer or Moderna. So if someone had the J&J vaccine single dose and they're at least 2 months out, it would be recommended to get the booster, typically with Pfizer or Moderna. And again, the third dose is for people with immune function issues. And if anyone is wondering if they are kind of in this third dose and fourth dose for immune compromise, it's usually for moderate to severe immune compromise. And it's something that people could clarify with their provider to see if they need to be on that course of additional primary series doses at 6 months. And the rationale behind the third dose that was given, and for the majority of people, they took that third dose for immunocompromised back a few months ago, and it's to improve the initial vaccine response from the initial vaccine series for people who have moderate to severe impairment in their immune function. So not most of the general population, this is less than 5% of the population. And I just wanted to mention that one of the perceptions or the misperceptions that occurred was that these vaccines just came out of nowhere. And this is Dr. Kizzy Corbett. She's been studying mRNA vaccine science in coronaviruses for years. And the reason she got into it is because it's an important area of virology. For example, with the SARS outbreak that happened over a decade ago, it can cause disease. And this is one of the types of coronaviruses that causes, it's very contagious and causes profound illness. So she was studying it, and she explains, because she thought, I'll always be able to be under the radar because it's not the most glamorous science ever. And now she's, on multiple committees and on the news often, and talking a lot about the science that she has been doing over years to get to have an understanding. And then this is Dr. Carrico. She's been studying mRNA vaccine science for 4 decades. And even though people kept discouraging her, she's continued to pursue it. And through her science and Dr. Corbett's science, we've been able to achieve getting a vaccine very rapidly because there's this background of decades and years of science. And I just wanted to underscore the fact we are concerned about COVID. This is also a year when it's important to get your flu vaccine because of the concern that flu cases are trending upward in the US and around the world. And we know that that you don't want to have the case where you end up with influenza plus COVID, or you don't really want to have a viral illness in this year. So flu shots have good effectiveness, and it's recommended for everyone to get the flu shot. Thank you so much for your time and attention.
Thank you, Dr. Williams. We have a few questions. Can you see the Q&A?
I can open it.
Yeah. And if you go to the bottom, start from the bottom, those are the ones that came in after you started speaking, I guess probably up until about 6:06. If you scroll up, I think Sophia, Miss Romero had a question. And there's a few questions in there, and I think they're probably more pertaining to you. The other questions in there, especially the ones that came from staff, I've copied those. And we're scheduled to have a staff meeting next week. And so we'll try to address some of those then. But we'll also do the Q&A that we'll post on our website. I wanted to pull up, before you answered the questions, give you a couple seconds to kind of look through them, kind of pull up the poll. And I'm going to end it now. So far, we've had 45% of those on the call had their child vaccinated, 31% are considering it, and 24% said, no, not going to happen. But I just thought that would be interesting information to have. And I appreciate you guys participating in the poll. Like I say, it's anonymous. I just wanted to kind of get a pulse as to how people are feeling about it.
Okay,
Dr.
thank
Williams.
you so much. Thank you so much. That's useful information. So I'm just going to go bottom to top through the questions that are for me. So one question is, every year I get the flu shot and get very sick. Why should I keep getting it? So the flu shot actually can't make you sick, but I would say that if there seems to be a pattern where you feel like you're having an illness, it's a time of year when people are getting viral illnesses, but you could talk to your healthcare provider to further clarify. But the flu shot can make you feel lousy for a couple of days, as every immunization that we take can make you feel a little bit, a little bit blah, because that's your body's physiologic immune response. Vaccinations in general can make people feel kind of tired or a little bit of arm soreness or, and that type of thing. But flu shots cannot cause disease. But if you have a concern that there's a pattern like that, you could always clarify with your primary care provider. But the flu shots do not have active virus that can make you ill. And then another question is, do you need to take the Johnson & Johnson booster if you've had the Johnson & Johnson vaccine? And no, you do not. And actually, the CDC had originally advised that you can mix and match and take whichever booster you want. But with their further guidance related to Johnson & Johnson, the majority of people would typically take the Pfizer or the Moderna vaccination. So, and with vaccines, boosters are a normal part of the vaccination process. For example, the classic one that you think about when you have an injury is your tetanus or your Tdap booster, because that's an every 10-year booster shot that's given to prevent, well, for the Tdap, it's tetanus, diphtheria, and pertussis, which is whooping cough. And that's given every 10 years. If you have an injury because of the concern about tetanus, you know, if you're out in the garden and you injure yourself on a nail on a fence, if it's, you know, it might be advisable to get a tetanus up to date and make sure you've had that done to prevent tetanus. So vaccinations always involve booster shots. That's always anticipated. It's something that early on in the pandemic, people predicted because they knew that it would occur because of the fact that vaccines give you an immune response that only lasts a certain amount of time, and the booster helps to kind of fortify that. And most vaccination series, when we're kids, have multiple vaccines in a series. And then subsequently, one might take a booster. So that's very typical for vaccines and the way that they function. So what people are taking now is one booster shot for the general population. It's only for less than 5% of the population where they would be taking a third shot and a fourth shot in an initial series. And that's because of immune function issues for special components of our population. But for the general population, we're talking about the one booster shot 5 months after Pfizer or Moderna, or at least 2 months after Johnson & Johnson. Another question that comes up is, can the vaccines alter your DNA? That is not at all accurate. The vaccines cannot alter your DNA because the components of the vaccine that make your body make the antibodies, the immune response, are only in your system for a brief period of time. So Dr. Frieden, who is a former CDC director, gives a good analogy. So it's kind of like Snapchat. In Snapchat, you know, you see an image, it's there for a brief period of time, it's gone. It's not coming back, it's not lingering. It's the same thing with the components of the vaccine. They pretty much, the vaccine gives information to your immune system that says, hey, this is something that we might see in the future and we need to fight it. So your body makes antibodies to it, but it can in no way alter your DNA. And actually, because one of the things that's been very concerning as a trend in society with social media is health misinformation has become more common. But particularly with both the pandemic and, you know, therapies that aren't effective that have been promoted on social media, and then also misperceptions about the vaccine, one of the things that the current Surgeon General, Dr. Vivek Murthy, recommends is to look at his information about health misinformation, and he has a lot of good resources and tools. Because one of the things that he says is, so there are only 12 people in this country that account for about 65 to 70% of misinformation about vaccines and COVID. And a lot of them are making money off of it, like selling you a nutraceutical that doesn't have any effectiveness at preventing COVID and things like that, or selling books. But everyone can have a role in trying to dispel misinformation and prevent the spread of misinformation. And so he has a lot of good guidance, you know, like, for example, are we getting health information from reputable sources like the Department of Health and Human Services, or our health department for the city or the county, or where we reside, or from healthcare providers? Because the DNA one's been popular. That's not true. Other myths: the vaccine does not affect reproductive health for men or women. Those are both myths. However, COVID-19, the disease, can affect reproductive health for men. There was a study in Italy that showed that 1 in 3 men who had COVID had erectile dysfunction of a very severe nature. So 1 in 3, they were having surgery to try to treat ED following COVID. However, the vaccine does not affect male reproductive health. The virus does. In addition, for women, the vaccine does not affect reproductive health, but pregnant women who get COVID have a much, much higher rate of hospitalization, stillbirth, death, and ICU admission. So the disease carries risk. The vaccine does not. And it does not affect your genetic material whatsoever. It can't impact your DNA. It comes in, tells your body how to make an antibody, and it's gone. So the effects that you see for the vaccine for children are comparable to what you see for adults. So kids might feel tired, they might have some injection site discomfort. Some people might have, just kind of the blahs that you can get, like a little bit of malaise after the vaccine. But one thing that we do know is children who get infected with COVID can have, severe disease. And again, the side effects that we get from a vaccine are just our body's natural immune response, so they're anticipated. But the side effects that you see are typical vaccine side effects. There are not any serious side effects with the vaccine in younger children. It's typical for what you'd see for any of the other vaccines that children receive in a vaccination series. So they might feel a bit out of sorts for a day or two, but that's about it. Some kids have no side effects after the vaccine. So it's not like there are serious side effects related to the vaccine. Again, if these vaccines didn't have proven safety and efficacy, they wouldn't be being advised. That's one of the things that the FDA is very rigorous about. So it's the usual things: soreness at the arm, at the injection site, sometimes feeling a little bit tired or achy, that kind of thing. The same as we see in adults.
I'm going to wrap it up right at this time. I really want to thank Dr. Williams. Great information, and we appreciate you taking the time to share this information. I think sometimes we kind of throw stuff out in the social media universe, but I think it's always good to have a talk with a person and an expert in your case. So we do appreciate you spending time with us today to help us get this COVID out of here. We're trying to get rid of it. We need to get back to some kind of normalcy quickly. So, and I want to also thank the parents, the families, the staff who are on the call. I appreciate you taking your time, appreciate your questions. As I mentioned, staff, we have a staff meeting scheduled for next week. And we'll also kind of go through and talk about some of these things, some of the changes, because I know there's everybody's not on the call. So we'll kind of go over these things again, because we want to make sure that you're aware of what the district is doing to help keep us safe and to help keep us in buildings, because that's the most important thing at this time, in addition to our health, of course. One last thing, just to let everyone know, we are planning a vaccination clinic. I'm working with the St. Louis County Department of Health, Dr. Cheryl Harris and I. We are looking to have a vaccination clinic at Lucas Crossing. Right now, it looks like it's going to be on January 25th from 3 to 7 p.m. in the cafeteria. And so we'll start sharing information once we get that time solidified with the county. We'll make sure we get that information out to all of our families and our staff and the community at large, because we want to make sure that if vaccinations are the route for you, we want to make sure that they are available to you. So you'll hear more information on that in the coming week. Again, thank you all for attending. If you have any other questions, like I said, info@normandysc.org. We're going to put together the FAQ based on the questions that we received, and get that posted as soon as we can. Thank you all. Have a good night. Stay safe, stay healthy. Thank you, Dr. Williams.
Thank you for the opportunity to present. Bye-bye.
No problem. Appreciate you.